Cheryl Hare of Arlington appreciates the simple things in life, like taking a leisurely walk in the park. It may seem unremarkable at first, but the more you hear about Cheryl's story, the easier it is to understand her gratitude for each step she can take. It all started after she had her right hip replaced.
It did not go well. I still had swelling. I was uncomfortable, still taking pain medicines. It was hard to walk.
Cheryl is a 77-year-old lady who came to see me. She recently had a right total hip replacement done by another surgeon, and she was failing to recover or make progress.
But after closer examination, Dr. Rapuri discovered a more pressing issue that needed to be addressed.
I noticed that she had a severe arthritic left hip as well. That was also impacting her walking ability.
It was bone on bone. A total hip replacement was needed. They decided on an anterior surgical approach, a minimally invasive technique that promotes a quicker recovery.
The recovery that you see is faster because you're not cutting the muscles. The pain is lesser. They're able to give up their walking devices. The recovery that you see is mostly seen within the first 6 to 8 weeks after the surgery.
Dr. Rapuri's technique also minimizes femur fracture during the procedure.
There is less amount of pressure on the femur, causing lesser periprosthetic fractures when you control the motion.
That surgery just went like a breeze. There was no problems.
After 8 weeks of recovery and rehab, Cheryl said goodbye to her walker and cane while welcoming her newfound independence.
Where I live, there's a lot of opportunity to walk. I have my little dog. She loves to walk too. I can get in and out of the car, don't have to use my cane. I would definitely recommend Texas Health Arlington Memorial. They have plenty of staff, so when you ring the bell, they're there.
Texas Health Arlington Memorial Hospital allows me to be able to do the minimally invasive hip replacement procedures like I did for Cheryl. They had helped me to obtain the necessary equipment and special instrumentations that are required.
It can be a little daunting to go into a hospital if you haven't been in one in a while.
My name is Samantha Church. I am the orthopedic coordinator for Texas Health Arlington Memorial Hospital. I do pre-op education. I'm their go-to person, along with the offices if they have questions about their upcoming procedure, hospital stay. So really getting patients prepared and knowing what to expect.
She acts as a resource for these patients, basically.
For Cheryl, her future looks bright. Her left hip is fixed. She's pain-free and continues to build strength toward her right hip.
I'm doing great. I have been for some time.
I think she has now done remarkable recovery, and I think she will make even more improvements in her gait and mobility as she continues with therapy and strengthening, and as time passes by to reach 1 year mark from her left hip surgery.